Hello, in this video I'm going to be talking about fertility preservation during treatment for cancer, specifically breast cancer. What causes problems with fertility, and what are your options if you're interested in preserving your fertility? Before I go on, I'd love to invite you to subscribe to our channel. We're always putting out new content, so there's always something new to watch. And if you have an idea for a video that we haven't already done, you can put it in the comments below. I'd also love to invite you to go to yerbba.com to get your personalized report. Your Yerbba report will take all of your medical records specific to breast cancer, and this is different from your patient portal. Combine them all and then cross-reference details about you and about the cancer that you've had or have, and offer you options, showing you the pros and cons of each to get you ready for your doctor's appointments to help you make an informed decision about the treatment that you'll be getting. So what causes problems with fertility? The number one problem with fertility is time. When you're undergoing treatment for cancer, we don't want you to conceive and have a pregnancy. During exposure to things like radiation therapy, chemotherapy, endocrine therapy, or targeted therapy, even during surgery, we'd prefer that you not be pregnant. So just the time of treatment alone, some people treatment can take a year or a little bit more. We don't want you to conceive. And if you're close to the end of your childbearing age, this could be a concern for you. The other thing is, our treatments can cause birth defects and miscarriages. So tamoxifen, a commonly used endocrine therapy, can cause serious birth defects, and it's absolutely absolute contraindication not to get pregnant when you're on tamoxifen. The other treatments that we like to avoid during pregnancy are chemotherapy. Chemotherapy and radiation too tend to cause spontaneous miscarriages. So one can't usually maintain a pregnancy during chemotherapy exposure, and both can also cause birth defects. So that's time and exposure to treatment during pregnancy. What about the effect of treatment on your fertility? Well, the number one culprit that can decrease your fertility is chemotherapy. Really, all chemotherapy treatments can affect your ability to have a pregnancy, but the most commonly used medication in the treatment of breast cancer is cyclophosphamide, or Cytoxan. That's the brand name, and you'll see that word capitalized on your treatment plan. Chemotherapy, especially cyclophosphamide, can actually affect your ovaries' ability to make ova, and that can make it hard for you to conceive, and it can actually put you into temporary or permanent menopause. So we don't like to give you exposure to this medication if you're hoping to have children after your breast cancer treatment. Now, the risk of infertility goes up with age, so people who are exposed to cyclophosphamide at a very young age are more likely to regain their ability to become pregnant than people who receive cyclophosphamide after the age of 30, for example. Really, there are lots of reasons, as you can see, where a conversation about fertility preservation and, frankly, also birth control makes sense during cancer treatment. If you are interested in having children after cancer, if you have not completed your family building, this conversation is particularly important. There are specialists who specialize in helping people regain and maintain their fertility after cancer treatment. They are called oncofertility specialists. Onco refers to cancer, and fertility refers to your fertility. So if you are not receiving care at a major medical center, asking for a referral to a center that has an oncofertility specialist is 100% within your right before you begin cancer treatment, if at all possible. Most people with breast cancer can wait. Except for very, very rare cases, you can wait to start your cancer treatment and see an oncofertility specialist before you start, in particular, chemotherapy or hormonal therapy. An oncofertility specialist will work with your oncologist to make sure that the treatments for both the cancer and your fertility preservation are coordinated. So what are the options for fertility preservation? What things might you hear about? The first thing I want to cover is going into a temporary medical menopause. I know that sounds bad, but we can actually make your ovaries go dormant or asleep so that the ova that are in your bodies that develop every month as you go through your cycles, so that the ova are actually protected. This is done with an injection of a medication type called an LHRH analog. These medications are given by injection and basically tell your ovaries not to have periods, which means don't develop ova. Don't get ready to release an egg into the fallopian tubes. Don't get ready to get pregnant. And the effects are reversible. So these are shots given every month, put the ovaries to sleep, and then after these go away, the ovaries wake up again. It can take a couple months, start to make eggs, and start to allow you to become pregnant. These are useful for a lot of different reasons. We've covered these medications in another video that we'll link to below. That's something that can be offered even if you are pursuing egg freezing or embryo freezing. So next I'm going to go into freezing of your eggs. Freezing of your eggs requires that the eggs be stimulated, and that's done actually with a medicine we also use to treat breast cancer, so it's no harm to your body. These are the aromatase inhibitors, and aromatase inhibitors are given to stimulate your eggs, your ovaries, to produce eggs, and then those eggs are retrieved and frozen for later insemination by sperm. This can be used whether you have a partner now or not, and its success is a little bit lower than the next thing I'm going to be talking about, which is freezing of embryos. If you have a partner or you use sperm donation, we can do this process where the ovaries are stimulated to produce eggs, and then sperm is given to your body, and then embryos are formed. Then those embryos are taken out of your body and frozen for later implantation. This has a lot of ethical and financial and some sticky family issues. For example, if the sperm from your partner is used to create the embryo and then you split up later, there have already been issues in the courts with who owns the embryos. And then, as you may know, in the US, there are some restrictions being put in some states regarding whether or not IVF can be done in your state. So there are some issues for which this may be fraught, but embryo freezing is actually a little more successful than freezing the eggs. The next thing I want to talk about is actually freezing of ovarian tissue. Freezing of ovarian tissue is done to keep the ovary tissue. It doesn't have to be both ovaries, but a good wedge of one ovary can be frozen and then put back in your body later. And this can help you actually get back to it can help with symptoms of going through menopause because you now have viable living ovarian tissue. This is still pretty exploratory. There are some studies showing that this is helpful, but we wanted to make all these options, we wanted to increase your awareness about all of these options. So suppression of the ovaries and then letting them wake up later, freezing of eggs, freezing of embryos, and freezing of ovarian tissue, all for later use. I do need to mention that there are cost issues. More and more insurance companies are including fertility preservation as part of their benefit. It's actually been shown to be cost effective and very good for insurance companies. There are still going to be a lot of out-of-pocket costs. There are a lot of grants that are available to you, so you don't necessarily have to say, I can't afford it, therefore I can't have it. A lot of foundations are able to give you funding to cover the costs of fertility preservation, which is really a beautiful thing. A lot of people who've gone through this and found it to be so beneficial to them have given money to patients who can't afford these treatments. The last thing that we need to address, and I'm going to address this just briefly, is the emotional toll and mental toll of having to make yet more decisions and go to more doctor appointments and spend more brain power thinking about what you need to do. You may think You may feel guilt. Why am I thinking about my family when I don't even have a partner and I should be focusing on the breast cancer treatment, or other people don't have this available to them? Why should I? I just want to mention that we see you, we hear you, we know these are issues. If you've had this sort of issue, if you've been through fertility preservation, share your thoughts and experiences with the Yerbba community by putting a question or a comment below. We try to get back to you within 1 to 2 weeks. Please be kind, we're only human, and we'll see you next time. Thank you as always for watching.